We have 4 pillars of treating cancer, but number 1 is stop making cancer. How do you stop making cancer? You change the biochemistry of the body. If you change the biochemistry, now the cells do not need to ferment anymore. They can go back to being healthy. So everything we do, and that we do with cleansing and colonics and lymphatic work and going to sleep early, balancing hormones, meditation, yoga, working on your relationships with your spouse or your family, all those things change the biochemistry so the body is no longer fermenting sugar. It's healthy again, so it's not going to make cancer. If you don't stop making cancer, it doesn't matter how good I am at getting rid of it, it'll be back. So someone who comes in with a lump in their breast, a tumor on their pancreas, is not really asking the doctor, how do I get rid of this? They're asking the doctor, how do I stop making it? How do I stop making cancer? So it's instead of a disease paradigm, it's a healing paradigm. People come here as a healing center. It's not a treatment facility. Now, in a treatment facility, the patient comes in, they sit back, and the doctors treat them. It's a passive role. They don't do anything. They just get treated, and they're reading their book, or they're on their iPhone, and they're doing stuff like that, and they're getting treated. Wrong. Doesn't work. Okay? Instead, the person comes here and they begin a journey towards health. Okay, and that journey it includes everything, including your parents. So that's the number 1 thing that distinguishes us from what they do in the hospital. Secondly, we target the cancer and eliminate the cancer without causing harm. That is, we don't use chemotherapy. We don't use radiation. Okay? We use metabolic therapies. Therapies that challenge the cancer cell based upon the cancer cell's enzymatic limitations. For example, cancer cells don't have certain enzymes that healthy cells have. So if you give high-dose vitamin C, intravenous high-dose vitamin C, the cancer cell can't metabolize that. It dies. Healthy cells love it. That is a metabolic therapy. B17, same thing. Cancer has one set of enzymes. Healthy cells have a different set of enzymes. It doesn't harm healthy cells. Kills cancer cells. Artesunate, same thing. Comes from the wormwood tree. It's a botanical. Curcumin, which comes from turmeric, intravenously, etc., etc., etc. So there are many therapies, botanically based therapies, that are what we call metabolic therapies, not cytotoxic therapies. The third aspect of the program we do is we wake up the immune system, because the immune system gets put to sleep by the cancer. The cancer produces certain chemicals, which are called cytokines. It produces interleukins and things like that, that actually paralyze the cancer, paralyze the immune system, inactivate the immune system. So the immune system, it's almost as if the immune system is blind. It can't see the cancer. Okay, so we wake it up. We have a specific set of therapies that wake up the immune system in the appropriate order. So now the immune system can do its job, which is to eliminate cancer. And the immune system is better than anybody, any doctor, any group in the world, because the immune system was designed by God to do that. Okay, so it's precise, exact, and it there's no side effect. Now the fourth part, which I consider the most important, is training and education. If someone doesn't change, doesn't get educated, doesn't learn what we're talking about, even if we're successful, they go back home, it'll be back. Because they'll go back to their old habits, they'll go back. For example, someone has lung cancer and they smoke. So they come here and we talk to them about quitting smoking, etc., and what's wrong with it. So they quit. 6 months later, they start smoking again. And that's how when I talk to patients too, if you're not willing and ready to change your life, to stop making cancer, we can't help you. All we can do is shrink it down and you can't see it for a month or two, but it'll be back. And that's not what you want. You don't want to have to be dealing with this the rest of your life. You want it to be finished. And if you want it to be finished, that means you have to understand that cancer is a tap on the shoulder by God telling you to make a right-hand turn because you're walking off the cliff. So that education is absolutely important. And it involves reading and all that. We have lectures. It's called the School of Life. We have a specific set of lectures so that when someone leaves here, they understand their body, they understand what it needs, how to take care of it, and how to live a long, healthy life. So who is that good for? Is it good for the person who has a tumor? Yeah. Is it good for the person who doesn't have a tumor? Yeah. We all need to know that. Because we didn't learn how to live. Nobody taught us how to live.